Gingival recession occurs whenever the gum line recedes below the crown of the tooth, so some root is exposed. It can also be associated with very thin tissue that can be more prone to irritation. So the big risks are increased sensitivity, either to hot or cold, or when brushing, which can make it more difficult to keep your teeth cleaned. It also can progress over time and can be an aesthetic concern. So the most important thing is to see a dental professional. If you have an established relationship with a general dentist, you can go see them and they can take a look and check, has it been progressing? And certainly if it has been progressing, that's the time to see a periodontist. If somebody has recession and they're having symptoms, say they're having sensitivity to hot or cold, they can always try a sensitivity toothpaste as a first line of treatment, and I recommend that for patients who come to see me, but it's also really important to be evaluated by our periodontist for treatment. These days, we've got much more minimally invasive techniques that are more comfortable for patients and lead to quicker healing. If you have been experiencing recession or you've noticed a change in how your gums look, we're happy to see you to answer any questions that you have and to get you the treatment that you need.